Well, hello everybody. Welcome to the Healthy Joints, Healthy Lifestyle show with Dr. Arinola Dada. I'm a rheumatologist in the greater Seattle area. For those who don't know me, I help people with joint pain become pain-free and people with autoimmune disease get their immune system back on track. So today I want to talk about a headache, and this is a special kind of headache that can result in blindness. It is crazy. So this headache typically tends to occur in people who may be older than 50 and sometimes from Northern European descent. But basically, this is a headache that starts off with kind of scalp tenderness. It's been known as giant cell arteritis or temporal arteritis. And it's called temporal arteritis because it is a headache that involves the temples. And that's typically where people feel the pain. So this is a headache that's not going to go away with Tylenol. It's, you're going to fall asleep, you're going to wake up from, it's going to keep you up from keep you up at night because headache is just persistent. It could be one or both temples, actually. And the big thing about this headache is that it can cause blindness. And so the reason why people have this headache is because there's inflammation in the blood vessels in the temporal region, but also inflammation in the blood vessels to the eye. And so, if there is inflammation in blood vessels, it can reduce blood flow and oxygen to the nerves that supply the eye, and so people can go blind. And so, this is one of those medical emergencies in rheumatology. We don't have a lot of them, but this giant cell arteritis or temporal arteritis is one of them. So, how does it present? So, people may have this severe headache, their scalp may be tender, they may have jaw pain. And I describe this jaw pain to my patients as claudication. So you're chewing and you're feeling a sensation of cramping in your jaw. And not a lot of things actually give that. That's almost a unique presentation that you're chewing and you're having a sensation of Charlie horses in your jaw. Fevers, I've had consultations in the hospital where a patient was admitted for like a week and infectious disease and all kinds of specialists were seeing that patient. Eventually they said, hey, why don't we call the rheumatologist? And in that situation, that patient had this temporal arteritis. When I asked the patient more questions, I found out that he had this dull headache. He didn't think it was a big deal. And in fact, it had some double vision, which he also didn't think it was a big deal. So in that situation, we found out that he had giant cell arteritis or temporal arteritis, but had manifested with this fever, weight loss, fatigue that nobody could really differentiate. So I alluded to double vision, sudden loss of vision, especially in people who've had this jaw pain is almost classic for this. And then, of course, people suddenly losing vision. I've heard patients describe it as a sensation of a cloud or dark, like a curtain being pulled over the eye. And so those are kind of typical symptoms. And some people with this giant cell arthritis, as if it's not enough, about half of them may have something that also causes inflammation in the muscles. So whether it's in the muscles of the shoulders or in the muscles of the hips, called PMR. I have another video of PMR, so we'll link it to this one. But about half of the people that have this giant cell arthritis may also have this condition called PMR. What are the things that put you at risk? Age, right? Like I hadn't said that already, right? So age is important. I would say being of Northern European descent is important. Women, for some reason, women are more likely to get autoimmune disease, and this one is not different. So women are also more likely to get giant cell arthritis than men. And then if there's a family history, what are the bad things that can happen? Blindness, right? That's the most important thing. So, we get calls from the emergency room. They think a patient may have giant cell arthritis, and then what are the next steps? And very rarely they can be this stretching abnormality of the blood vessel that kind of leaves the heart, the aorta. So some people can have this thing called an aortic aneurysm. Now, this is not common and this is not the first manifestation of giant cell arthritis, but it's something that your doctor is thinking about and watching for. Rarely it can cause strokes, but that is not the most common cause of strokes. So how does your doctor make this diagnosis? So after getting the history from you, kind of trying to pull out those symptoms that you've had, they also run some blood tests. For most commonly, the sedimentation rate and the CRP, those are two most common inflammatory markers, and those things tend to be elevated. And then when that's done, then your doctor may want to run some tests. So sometimes they can do an ultrasound of the blood vessels, and it can show inflammation. Sometimes they do the special MR angiography or MRA, which kind of uses contrast to try to see again if the blood vessels are inflamed. There's a very expensive test called a PET scan. I don't think anybody's really going to do it just because it's so expensive. But the most common thing that we have patients do is a biopsy. It's pretty simple and it sounds like, okay, it's invasive, but it's really very superficial. So usually it's a day case. They go in there, they take a piece of the temporal artery, they stitch that up. Usually it's a day case, it's not an invasive surgery. And then they go to the lab and they slice it into tiny little pieces and they look under it to see if they can catch or find that inflammation, which confirms that diagnosis. So, all said and done, thank you very much, Dr. Dada. How do we treat this condition? So, one thing that we that is a standard of care is steroids, and we use a lot of it. Usually I'm preaching against steroids, but in this situation we use a lot of it. High doses of steroids. Sometimes it can be an intravenous form of steroids, sometimes it's high doses of prednisone, depending on what else is going on. Now, how imminent your doctor is concerned about losing vision, right? So, and sometimes you have to continue the medication for up to 2 years. So the good news is that there actually are other medications that are being used. So FDA approved a few years ago a medication called Actemra, which can be used to prevent, one, the vision loss, but two, also minimize how long you have to be on prednisone for. There are also clinical trials that are ongoing that are very exciting. We have some clinical trials in our study, so we'll also link that to the end of this video. But definitely, I mean, if you have symptoms of giant cell arthritis, it's an emergency. I had a patient, I'll tell you this story. I had a patient when I was a little resident. I hadn't even done rheumatology yet. And he came into the hospital for cardiac issues, right? But he happened to be on my team, and we were kind of rotating, and he was my patient under my care. I was very interested in rheumatology at that time, so I would sit down and talk to him, and I found out that he'd lost vision in one eye about a month before he came into the hospital. And when I was talking to him, he was concerned that he started to see double vision in the other eye, and he thought perhaps he should tell somebody. I called the rheumatology team at that time, and I said, I think this gentleman has giant cell arthritis. They biopsied, and they found out that he did indeed have temporal arthritis, and he was put on steroids, and that saved the one eye that he had left. So one of the things is, he didn't want to bother, and he's just such a nice guy. He did not want to bother anybody, and so he didn't tell anybody. And I was like, let's save the eye. So we did save his other eye, but for my patients, I would rather we didn't have that situation where we are losing vision and just trying to save the other one. There are things that we can do. You don't have to suffer in silence. Our goal right now is we want to make sure that our patients thrive and have the best quality of life possible, right? So we want to get the word out. There is treatment for a lot of these conditions. Let people know that they do have options. People are afraid to be on steroids. There are options to steroids. There are clinical trials you can participate in. So if this has been helpful, please share it with anybody that you think may benefit from this, any friends or relatives that you have. Do like it and subscribe it. We promise to give you more helpful tips to help you on being healthy. We're all living longer and longer, so we definitely want to make sure that we're having that quality of life. Well, thank you so much for listening. Again, my name is Dr. Arinola Dada in the greater Seattle area. If you have a rheumatologic condition or you know anybody who will benefit from seeing us, we have a team ready to help you. So thank you so much for listening. Have a wonderful day.